Hello everyone. Previously, we studied how to recognize and treat the cold disease. For today, we are going to talk about another common disease, headache. Headache is a very common disease along the clinic. A lot of people care about how to treat this disease and how to relieve the pain in head. Headache is a condition that is manifested by pain in head. It may appear by itself or in the course of many acute or chronic diseases. Many diseases in terms of Western medicine, such as hypertension, hemicrania, vascular headache, trigeminal neuralgia with headache, may be differentiated and treated with reference this section. Externally, because of abrupt climatic change, irregular lifestyle, sitting or sleeping in the wind, or living in a cold, damp environment, one is likely to be attacked by the external pathogenic factors. Wind, cold, heat, and dampness pathogens invade from the superficies of body to the meridians and calendarus, and move further upward to the top of the head, then induce the obstruction of clear yang. Furthermore, the osmosis flow of qi and blood, as well as the blocking of vessels and calendarus, result in headache. Internally, deficiency of kidney essence, emotional impairment, and dysfunction of spleen all can result in the blocking of vessels and calendarus, stagnation of qi, and stasis of blood. Further, induce the blockage or insufficient supply of nutrients, then headache may happen. According to the external and internal pathogenic factors, the syndrome differentiation of headache includes external contraction syndrome and internal damage syndrome. For the external contraction syndrome, external wind, cold, heat, or dampness pathogens may invade the superficies, then induce the clear yang failing to ascend. The headache patient caused by wind-cold pathogen may have the symptoms and signs such as headache with sudden onset, aversion to wind and cold, nasal obstruction, thin and white coating, as well as floating and tense pulse. For treating the headache with wind and cold, the therapeutic principle of dispersing wind and dissipating cold is usually used clinically. Tranxiong chatil powder can be selected to disperse the wind and dissipate cold, then relieve headache. Acupuncture is a good way to relieve the pain of head. Stomach meridian 8 and gum meridian 20 can be selected and the acupoints to be stimulated using needles. This stimulation in the acupoints can help to expel wind-cold pathogen as well as to relieve the tension and pain of head. The patient with wind-heat attack may have distending pain in the head, aversion to heat, flushed face, thirst with desire to drink, red tongue with thin and yellowish coating, as well as floating and rampant pulse. The therapeutic principle for headache caused by wind heat should be disperse wind and clearing heat. Sangju decoction is usually picked to treat the headache by dispersing wind and clearing heat. For the patient attacked by wind dampness, the symptoms include headache as if ramped by something, heavy trunk and limbs, poor appetite, whitish and greasy coating, and the pulse should be soft and floating. Expelling wind and eliminating dampness is usually used to treat the headache caused by wind and dampness. 羌活圣师 decoction is clinically used to help the body to expel the wind and dampness out of the body, then relieve the pain of the head. Whatever the type of the pathogen is, all the patients with external contraction syndrome are suggested to press acupoint. As the pictures shows, this will be very helpful to relieve the pain. Compared with external syndrome, the internal damage syndrome usually caused by the disorder of internal organs or emotions, then induced to deficiency of essence, qi, and blood, as well as blood stasis. The clinical manifestations of deficiency syndrome may be as follows: chronic headache, dizziness, weakness, insomnia, pale tongue, and weak pulse. For the deficiency syndrome patient, tonifying and nourishing essence, qi, and blood is a basic therapeutic principle. Bajian decoction is commonly used to improve the headache. This formula can relieve the headache, which is deficiency, by increasing qi and blood for the patient. And because the qi and blood are difficult to be increased, it will take a relatively long time to be cured. Acupoints, Gardner Meridian 20 and Spleen Meridian 6 can be selected to be stimulated to improve the deficiency syndrome. If the headache is caused by static blood, the patient may have the symptoms and signs like lasting headache, aggravated at night, purple spotted tongue, and thready pulse. All the symptoms, tongue and pulse, are mainly caused by the static blood. Therefore, to relieve the headache, the doctor needs to activate the circulation of blood by using Chinese herbs. Usually, Tongqiao Hexue decoction can be selected to treat the disease. This formula is composed with Chinese herbs with the function of promoting the circulation of blood, so the formula can relieve the headache pain by removing the static blood. For the static blood syndrome, acupuncture can be carried out for the headache patient. Commonly, acupoints level 3 and spleen meridian 10 are selected to promote the circulation of blood by stimulating the qi inside the meridian. To sum up, we have talked about the concept, pathogenesis, syndrome differentiation, clinical manifestations, therapeutic principle, and therapeutic formula of headache. Therefore, if we have a patient with headache, we should check the patient first, including symptoms, tongue, pulse, etc. Then analyze the information from the checking to make a diagnosis. Comply the therapeutic principles and make a prescription for the patient. This is a whole process to deal with the patient in clinic. Okay, that's all for today. I'll see you in next class.